The new change has to do with the cost of colorectal cancer screenings. Before today, if you received a screening and a polyp was identified, you could receive a surprise bill because insurance would consider that a therapeutic test, not a diagnostic or screening. Now, Virginians will not have to worry about having any deductible, co-insurance, or any other cost-sharing requirements. This is important, especially in the Commonwealth, because the American Cancer Society has identified southeastern Virginia, which includes Hampton Roads, as one of 3 hotspots for colorectal cancer in the United States. The disease is also the 4th most common cause of cancer and cause of cancer-related death in Virginia, with around 3,400 Virginians receiving a colon cancer diagnosis each year. Sadly, 1/3 of those people lose their lives to the disease, according to Dr. Bruce Waldholtz with the American Cancer Society. He also shared some signs you should look out for if you're concerned about the possibility of receiving a colorectal cancer diagnosis.
Signs or symptoms of colorectal cancer could be, number 1, could be nothing. Number 2 could be rectal bleeding, change in bowel pattern, or abdominal pain. In the past, say 40 years ago, if a young patient in their 20s or 30s went to the doctor with a little bit of rectal bleeding, they'd say, "Oh, you have hemorrhoids, that's just what happens." That's no longer true. There are patients in their 20s and 30s getting colorectal cancer, or 40s, so rectal bleeding should never be ignored.
This new year, the American Cancer Society wants you to reach out to family and friends who are between the ages of 45 and 85 to make sure they receive their routine screening. As a reminder, you're able to take a stool-based test in the privacy of your home, or you can take off work and go in for a colonoscopy. In studio, I'm Caroline Colburn, CBS 6 News.